All right. Hello, everybody. I apologize to everybody. I am, this is Dr. Ken Shamley, and I'm kind of speaking here today. I had started this meeting about 20 minutes or so ago, saw that no one was attending, and then I got a message from one of our tech guys saying, "Hey, did you start this?" And I said, "Yeah, I've been talking for like 20 minutes, and it doesn't seem like anybody else is here." He said, your message ID or your ID for the session doesn't look like it's the right one. And I said, okay, I believe that. So I'm going to start over. And I guess I'm going to try to get through what we can get through. This has actually been a little bit of a day of errors, and I certainly apologize to everybody. I had prepared a good 66 slides or so around this topic today, given the fact that I've certainly done some research in this area and do a lot of practice in this area around using visuals to increase tolerance for waiting in children with autism. So I was very excited to do this. But let's start fresh. So anyway, what happened with the 66 slides, I lost my whole presentation around 11:30. Unfortunately, I had to see a patient. Got a few things up here, and so I'm going to try to do my best. And if I can, I will record. I'll make a whole other new set of slides that might be a little more detail, so that if anybody wanted to refer back to it, it would have some of the original content that I was hoping to share today. So there's lots of different things to apologize for here today, right? Apparently, we got off to a slow start. Secondly, we also I've had to kind of redo my slides, and I'm going to do my best to kind of make the main points that I want to and share what I can. So let's kind of go through where things are at. So some things I want to just kind of emphasize as we kind of get off the ground here is that if you're using Zoom, there is a Zoom group chat function. Obviously, if you're here, if you are joining by phone or computer, simply putting yourself on mute would help reduce any sort of background noise. If you have any questions, that you would want to ask, certainly feel free to, again, use the chat box on your screen. There should be one there. And when we get to the end, I'll take a chance or an opportunity to review or answer questions during some Q&A, and whatever you're willing to kind of stick around for, basically. So let's leave it at that. And I'm going to kind of dive into, again, a few quick initial plugs for some different things, an explanation of who I am and my connection to the Rochester Regional Autism Center for Autism Spectrum Disorder. And then we'll kind of get started. So let me kind of go from the beginning here. Okay, so like I said, my name is Ken Shamley, and I'm one of the faculty here at the University of Rochester. I also am a part of this, the regional center here, and I also am the director for the behavioral treatment program. So some of what I'm sharing today is certainly based off of some of the research I've done in the past. In addition to that, really a lot of it comes from the clinical practice that we do here. So, okay, and so I'll be kind of sharing it from that perspective as well. And so these are things that not only maybe are experimentally good, but at the same time, they're twists and innovations on some of the basic concepts and things that we know that work well for really kind of teaching kids to wait, which is not always an easy thing to do. So, again, we're one of the 7 sites here that serves New York as one of the New York State regional centers. And I also just want to kind of do a quick plug here for Dave McAdam. He's going to be doing another webinar in February for behavioral assessment and intervention for self-injurious behavior. So a nice kind of addition to what I'm talking about today, because even though we're talking about different kinds of behaviors, we're talking about increasing waiting. We have certainly seen quite a few kids within our practice, and certainly in the different kinds of clinics that I've worked before, where once we kind of identify why a kid might be engaging in self-injurious behavior, And it might be, again, for maybe something like attention, maybe to get out of doing some particular harder task for them, or maybe it's also to gain access to maybe some preferred item or activity. And there could be other reasons too, or combine some of those together. We're often trying to figure out, okay, we know what you want. Now how do we teach you how to wait for it? So much of this is particularly relevant. And some of the things that we use that I'm talking about today, actually really relevant for severe challenging behavior, which is where some of my background is from. Okay, so again, I want to put a small caveat for the fact that there's not going to be a whole lot of slides. There's a lot of things that, some visuals that I was hoping to put in here that I'm not, but I'm going to try to find a way to make them available to you. So stay tuned, and we'll kind of make sure that it's, available to you. Again, just a certain note that once this is actually all done, you should get an email with a link to a survey. You should also get a link to, I believe, the recording of the webinar itself as well. So please pay attention to those as they kind of come down the pike as well. Okay, so after that, again, also with that link, I should also just quickly mention that you should get a certificate of attendance, usually for some sort of CEUs. I'm not particularly well versed in what that might look like for you. So I'm kind of speaking on behalf of Val, who is, usually here to kind of introduce things. So I'm a little bit of a newbie for this. I might do presentations at conferences, don't always do webinars. So let's talk about waiting, right? So waiting is just like a universal skill. It's really kind of hard for any child to learn. So this isn't just kids with autism. This is really kids really across the development kind of spectrum, right? So usually we find that this is a skill that we teach at a relatively young age, or we certainly try to. And, because waiting is so hard, we typically see a lot of emotional reactions, right? So, we typically use, because we have these emotional reactions, our first response as parents or caregivers in any shape or form is actually also about, we're trying to explain and comfort the child, right? Because many kids can understand maybe some simple rationales. We might kind of like take our language down into simple levels. But usually we can kind of give some sort of reason. And, that would be kind of like, what you would do as a parent. And I apologize, I'm getting distracted. I'm trying to make sure everyone's kind of connected and seeing and hearing what they need to hear. So in general, that makes sense. Waiting is hard, and we have lots of ways that we typically would respond to it, because that might be what comes natural. Now, we do have different types of waiting, right? So there's really a kind of a spectrum for different types of waiting that we have to do. And so there might be actually other things that we would list here as different maybe situations where a kid might have to experience waiting, but I kind of selected out many of the different types of what we typically encounter, at least within our clinic, and or different places that I've been. So obviously, it goes from shorter to longer. So there's those times where, like, momentarily you just have to wait a few minutes. So this is mom and dad at home, or the teacher in the classroom, where I just need to prepare a snack. I need to charge my iPad. I need to get these things done. It's just going to take a few minutes. Or you might have something that you would expect later that day. So going to the grandparents' house in the afternoon. This could be something, again, that the kid is excited for. And, they would, if they could go to they'd want to go to grandparents' house right now, but they're going to have to wait for it in the afternoon. There's also just certainly after completion of specific activities, that would make sense. And of course, it might just need to happen on another day. Most of us would not take a kid to McDonald's on every day. So we have different kinds of times where we would say yes, and different times where we might need to say, no, you're going to have to wait. And of course, ultimately, we probably sometimes just have to kind of say no, right? There is this other part of waiting that starts because we just have to deny the request. It's impractical. It's infeasible. I'm not able to kind of stop what I'm doing to do what they're doing. That's one. But really, this one is really kind of like, we can't go to Seabreeze. If you guys are in the Rochester area or Irondequoit, this would be kind of the thing that you'd be looking for. You might have kids that want to go to Seabreeze and they want to see the jackrabbit, or they just have to do these things that could be part of their rigid routine, or it could just be part of, actually they want to go and enjoy the ride, but you can't go to Seabreeze. It's the middle of winter. And the truth is we're 50 miles from it or something. And I don't know when we're going to be able to go. So sometimes the answer is no, and it really is another form of waiting when we deny kids this way. It's pretty rare that we really have situations where you have to say never, right? I don't think there's too many situations where I say that you can never have that to a kid. Those aren't the things that they typically ask for because they would have had to experience it in some way. And usually the things that they've experienced once are things that, for the most part, we'd figure out maybe there's a way for them to experience again. So it's a matter of when this is going to happen, not usually a never. So you guys might be folks that are already working with kids with autism, or you're a parent of a child with autism. And so I'm going to probably say some things here that might be some tidbits of information or experiences that you're already very familiar with. In general, there's it's not uncommon for kids with autism to have some difficulty understanding verbal information. There's this part of it that could be related to poor language skills. That could be whether they have trouble expressing themselves, but in particular maybe sometimes understanding what others are saying to them, and then also processing it and making sense of it, in the context of what they want. So, a lot of times when kids are asking for what they want, you might be trying to, again, still give a rationale or explain when it's going to happen. And it's a hard thing to actually sometimes explain time. That's a really abstract kind of way or thing to talk about, of when things are going to happen in time and space. So that's tricky. But then also, if they're asking for something, it means that they probably really want it. I find that my kids with autism, when they want something, it's not uncommon for them to kind of want it really fast, or they want it really badly. And so this kind of a ability to kind of just tolerate waiting and having this kind of emotion regulation or emotional reasoning that you would expect for their age is not there. You can't necessarily look at your 16-year-old or your 12-year-old or your 5-year-old and say like, oh, they'll be able to handle it. You're expecting different kinds of or different levels of skill here for being able to regulate these things. And so that's hard. I also want to mention in general, often we find that, when there's our kids with autism, they're routine-based, right? So they might have some anxiety or some stress when you have a deviation from the typical routine. So, in many ways, waiting could mean a deviation from a typical routine. Maybe the power's out and they can't access their favorite online game right now. Maybe someone got sick, and so that they can't go to grandparents' house and they can't go somewhere else within this typical sequence of which something is going to occur. And so they might have to wait until the next day, or they might have to wait until they get a few other things done, or the power comes back on. So in general, this is hard. It's a level of uncertainty. So when we say anxiety and stress, it's because maybe they're not certain, when is this going to happen? Because maybe later is not a comfortable feeling. It's not a comfortable thought. They are now not able to predict when this is going to happen. And that's, any one of these kinds of reasons could certainly start to evoke some challenging behavior. And, depending on the severity of it, It could be really distressing to the parents and other educators and other adults too. So another thing I always like to point out, and again, I'm going to make a small mention here that we're talking about kids with autism spectrum disorder, but the reality is that many of these same kinds of difficulties and many of these same kinds of tools that we're talking about today are really the same kinds and types that we would think about for kids that might have other kinds of intellectual or developmental disorders. It also, could easily apply to kids that have certain moderate to severe types of ADHD. So they all fall underneath the umbrella of neurodevelopmental disorders. And I believe on the Rochester, regional CASD website, there is actually a previous recording, or at least a presentation tip sheet regarding executive function deficits. And I think that would be in neurodevelopmental disorders, that might be worth your while to take a look at, because I talk about that a lot with the patients that I see here for our behavioral treatment program and or for even our diagnostic kind of visits as well. So broadly, executive function skills apply in every domain of life, social, academic, daily living. And it's really kind of that ability to kind of step into any situation, analyze and organize the information of what's going on and what needs to happen next, making a plan, and then predicting the consequences and adapting appropriately as you go along with completing your plan, all the way until it's done. And so imagine the kid with autism, or maybe some of these other difficulties with executive function skills. Something changed. They're already starting to get emotional. And now they're having you trying to explain verbally to them why the change needs to happen and when they'll be able to do it. But now they've got to take all of your verbal information and process it, organize it, come up with a plan. Obviously, that's not their plan A. Maybe it's their plan B, right? So we have a lot of different things that we use with kind of curriculums that we have for executive function skills, that deal with these kinds of issues, or different ways to kind of teach these kinds of skills. So in general, what we find is that, these kids imagine that they're trying to do all this and do it verbally. And it's just, we find that it's just very hard for them, and it's not necessarily easy. It's also not really clear to them exactly all the things that you're saying, and helping them kind of figure out, like, well, yeah, so I still want it, so when's it going to happen? In general, we just find that they, again, not really understanding sometimes those longer term consequences, and maybe sometimes even the consequences that might influence a parent or a teacher's moment-to-moment decision-making. So, for example, like, what if you had a kid where, they might get a cookie like Monday, Tuesday, Wednesday. Dad finally looks in the cookie jar and is like, man, we've only got one cookie left. How many cookies has this kid been eating? And then all of a sudden they're like, well, I don't think it's healthy for my kid to have that many cookies. I'm worried about his weight gain. He's already maybe on Risperdal, and this is something that we should be watching out for. And, he's asking more and more for these things. At the end of the day, I just don't think this is healthy anymore. And now they want to change the rules. From the kid's perspective, everything in the world is working right, because he's now got a routine. He's getting a cookie before dinner, and that's great. And you decide on Wednesday night or Thursday night that you're like, I'm just not going to do the cookie anymore. All of a sudden, you now have this difficult situation where, the kid doesn't understand the long-term consequences of eating that cookie every day. And he certainly isn't understanding things from your perspective. And so not kind of being able to think outside themselves and think of the long-term consequences and all the things that might be going on, or what the other person might be thinking, are also contributory towards some of the difficulties they have for waiting. So teaching waiting is an interesting thing, because in general, through just natural experience, most of our kids that we know, of course, they learn waiting naturally, right? So they just kind of naturally respond to what their parents are saying as you reason with them about why they have to wait. And, they've learned to wait by observing others or by following rules. So they've they've learned to wait through a number of different methods that kids with autism just don't naturally do, right? So they're not naturally always like socially observing other people and doing what they're doing socially that's appropriate. And that includes waiting, right? They live in the moment. And as they live in the moment, they're responding to, what their wants and needs and their whatever else is going on in terms of what they think should be happening. So the other kids might learn naturally. Kids with autism really probably not always, but sometimes need to be taught explicitly how to wait. And it's tough. So we find that, if you've ever been to any other kinds of talks, and you'll probably hear when Dave talks about this next February, this next month, we kind of have an idea of that communication is a part of sometimes what is contributing to sometimes like challenging behavior. So if kids can't really communicate, there's always that first step of like really teaching them communication. But if they've got communication, we now need to kind of figure out like, well, they're really communicating because they want something. They have a need, a desire, or a want for something that people used to give them for when they would engage in maybe some challenging behavior. But now we want to teach them something else. We want to teach them maybe a better way to ask for what they want, so they don't hit, maybe they don't like scream or pound their fist or, maybe yell out, something. Instead, they just kind of ask nicely. They exchange a card. They touch a card that kind of helps them communicate. They use their augmentative alternative communication device, like an app on an iPad or, some other kind of other speech language device, whatever the case may be, or sign, right? So we train up something else specifically, but then we got to teach them like, well, I can't give that to you all the time because again, sometimes it's impractical, it's infeasible, it's just not possible, or it's just not healthy. And so in those cases, we still have to teach them to wait. We've figured out how to teach kids how to communicate functionally decades ago. I would say definitely well over 2 to 3 decades ago. We figured out how to teach them how to do that. We know how to do that. It's called functional communication training. First published paper was back in like around 1976. So we know how to do that. The harder part that we've been working on probably for the last 2 or 3 decades is how to best teach kids how to wait in a way that they still want to communicate for what they want, but also so that we don't see too much problem behavior. And so much of what we use today when I have kids in my clinic is really kind of born out of really a lot of the research within like the last 2 or 3 decades, really just about waiting. And it doesn't seem like it's really come that far, but we're using the things that we think are most available to us and the things that seem to show us the best bang for our buck. So what we found, of course, is that teaching waiting with visuals is pretty important. Visuals are visual. Since we know that kids with autism might have some difficulty processing verbal information for a variety of reasons, it sure does help to present them with this information visually. They seem to just really kind of connect with this. And to be honest, it's not that much different for us, correct? I certainly have my Outlook calendar. You might have like a fitness tracker to keep track of different things that you're doing with your activity, with your diet, with your biometrics for like your heart rate or other kind of wearables that track different things for you, or your sleep. In general, for whatever reason, we all seem to probably process things visually much better and much more quickly than we do verbally at times. Not that we can't, it's just that it helps, right? We all look like looking at graphs or pictures of things that help elucidate what's going on. And so we find that it's also very effective for kids with autism. It certainly provides a certain kind of structure, the visuals do. They can provide a sense of really clear what the routine is and predictability. We find that it helps to ease anxiety. Also seems to help ease, just general kind of stress. And it helps in other ways, and I'm going to point those out hopefully as we go along. One of the things I also like to point out is that when we're thinking about teaching weighting with visuals, they're proactive, okay? So in general, when we think about visuals, they have to be created. And so if they have to be created, that means you're thinking about, anticipating and preparing for those situations that can be really difficult for a kiddo. And if you're anticipating these things, that means that you're probably ahead of the game. You're trying to figure out how to communicate to a kid before there's a communication breakdown, is how I like to think about it. So it helps you because you're kind of preparing for a situation and how you're going to react. Because a lot of times, even for like parents or teachers, maybe sometimes they're not always thinking about really what they want to have happen, right? So if you wanted a kid to only have 2 snacks a day, maybe sometimes you didn't really think about that beforehand. Maybe you're just kind of like, very slowly you're just kind of like, oh, he asked for a snack. Oh, he's asking for something. Oh my gosh, isn't that amazing? This could be especially for kids that don't do a whole lot of independent kind of requesting. When they request for something, you're just getting very excited and you want to honor that and reward it really. And so it's great. It's independence. But then they start eating like maybe 3 or 4 snacks or whatever. And then you're like, well, maybe that's, again, kind of going back to the cookie situation, maybe that's too much. But now I've got the situation where they've already been expecting this. So how am I going to change this around? And, so when you think about using visuals, I think them as being proactive. They need to be created. They need to be thought of like how they're going to match to the situation. And it helps prepare you for a mindset of like, what are your rules? What exactly are you expecting for the day, for the week, for the month, or for even like the next 5 minutes or 10 minutes or half hour? So thinking about those things is what I find very helpful. And of course, the other part is we know that things are going to come up in a kid's life where we have to deny them things. And so anything that we can use, like visuals, to prepare them to decrease some of the anxiety and frustration, and communicate to them very clearly what's going to happen or not happen is important. And I want to reemphasize this point again. Once a kid, and this is my speaking as a clinician, once a kid is actually getting emotionally upset, you've turned a corner that you can't talk to them anymore. You've turned a corner where really kind of rational, kind of thinking, rational types of like reasoning back and forth, even if they have verbal skills, is just not going to be the way to go. You might just have to kind of ride the wave and wait for the emotions to kind of come back under control, and how long that takes, in whatever way that takes, and then maybe there's some way to introduce, something that would help explain like why it's being denied. But once a kid is actually already upset, even for kids that don't have autism, it's just like you're really just not really kind of solving the issue. And in some ways, it's almost making it worse for most of the cases that I see. So you intervening early and more clearly is kind of the way to go, of course. It's not going to happen like you can do it every time, but I think visuals are a good way to do it. Also, one of the things I want to, again, make particularly clear here is that when we're teaching weighting with these visuals, we're taking an abstract concept and making something into a really concrete kind of visualized form. And it takes all that ambiguity out of the situation and hopefully making it clear for a kid. So the reality is that you and I might have some really kind of clear ideas by looking at people's nonverbal facial affect and kind of changes in, eye gaze and kind of like, rolling eyes, winking, grimacing, that would make it clear that maybe something's changing in the context. But, our kids with autism really are just not going to probably do that too well. They're in probably a little bit more of their own world. And even if they did see you do it, they may not know how to interpret it. So they just have difficulty reading those contextual cues. And it's hard. And, one of the things that was in my original presentation here, and again, I'm hoping to provide, just for those that joined late, or later than I did, I'm hoping to provide another set of slides that really kind of helps emphasize that there's a research base behind all this. And some of the research that I conducted was also on this issue of, sometimes, ultimately we would love for kids with autism and other developmental disabilities of any type to be able to take a look at what a parent is kind of like doing, or their nonverbal kind of expressions, and just looking at their overt behavior and figuring out, is this a good time to ask, or is this not a good time to ask for what I want? And so I done a study that completely kind of really tried to kind of tease us out, because we've had some success in some of the research with actually being able to teach kids to watch. Again, this is with repeated training, by the way. This is not something that you would have. I could try to explain it to you, but for you, it might sound bizarre, because it's kind of like, well, it's really some very specific training and it's rather repetitive. But they've had some success with teaching kids like how to watch an adult doing a certain kind of activity, and by either responding to the kids' requests for what they wanted, like maybe they wanted some attention or to play a game or something like that. By doing these activities and pairing maybe one activity that was kind of like where an adult would be kind of busy and not be able to typically respond, they may not be able, they'll ignore the kid if they ask. But then there might be times within that training session where if they were doing a non-busy kind of activity, that if the kid did ask for some attention, then the adult would give them some attention and sit down with them for a game or do something with them. So we have this kind of idea of trying to train kids to recognize when an adult is busy or not busy, by pairing that with like really clear consequences of giving the kid what they want. But sometimes it's not that discernible, right? And so I have a number of situations that we ran into in the clinics that I've worked in, where the parents would come and say like, well, it seems like whenever I'm trying to do this, my kid has a hard time waiting. Like I'm trying to get some work done on my laptop, and he doesn't seem to understand, like I can't come like push him on the swing. I can't come do what he wants to do. I can't get him what he wants. But then there's other times where obviously the person might be on their laptop and they might be looking at e-entertainment news, right? Or you might be playing a Facebook game. But for a kid with autism, how would they know? They don't know what Facebook is, probably. Maybe not. Maybe they do. Again, there's a wide spectrum of abilities here. But it could be really hard for some kids to understand, like, when is my dad or my mom busy? And when are they not busy? Because it looks like what they're doing is very similar. And so reading those contextual cues about when someone might be busy or not busy is really kind of hard. And so we find that using visuals helps make those signals very clear. And I'm going to use the word signals, but there are some really kind of nerdy terms that I like to call it that we use. Things like, SD and S delta, or discriminative stimulus and S delta, or something like that. I'm not going to go there, but like I said, our research over the past couple decades here is really kind of has borne out that visuals are very effective ways to teach waiting. And so a lot of what we've done in our clinic is taken things from research that we've either done in the past or in just our clinical practice, and made them kind of work for us and the families that we work with. And so again, making these signals very clear is something that when something's available or not available is pretty important. And this is something that maybe if you've worked with kids at early intervention, or they've received some different kinds of educational instruction using a methods from applied behavior analysis, this is something that would be very familiar. So using things like a really a really clear phrase to signal that, a kid would need to respond, and then there would be the potential for a reward or reinforcement for that. So again, this is something that would be relatively familiar for many types of teaching methodologies. But, like I said, lots of the signals we respond to on a day-to-day basis are kind of subtle. But one of the things so some things I want to emphasize is that when we're teaching a child to wait, or teaching your child to wait, we're not going to wait for some of these things to just kind of happen. You can teach your child, or you can teach a child to wait in the presence of a signal, or not wait. And essentially what you want them to realize is that when a certain signal is present, what they want is available. And and those requests are reinforced, or what they want can be delivered, And then when the signal is not present, or maybe there's another signal showing that what they want isn't available, it's just not available no matter how much they ask or what they do. And so sometimes we say that this is what you'll hear people refer to as, the requests that they're making are put on extinction, or you might know the term planned ignoring. So if you might have one signal for availability, one signal for unavailability, or sometimes it's the presence of a signal or the absence of a signal. Those are the two kind of main ones that we tend to kind of understand and use a lot. So I always like to take this opportunity to kind of give the example of a vending machine. And I'm going to use one of our postdoc fellows here, Dr. Jennifer Herrera. She loves Coca-Cola. So if, when you see a Coke machine and the lights are on, it means that, usually what I take that as a signal for is like, okay, Coke machine's working. If I put my money in, I'm going to get I should be able to push a button and I'll get a Coke. If the light is not on and I put my money in, odds are I'm probably not going to get a Coke. So by analogy, you could think of this as if you held up a certain kind of a signal to a kid that you trained up to signal when what they want is available, and they actually asked you for what they wanted, that would, what they asking you for what they wanted would kind of be like the quarter. They can always put the quarter in. But if the light is on and they put the quarter in, they would, begin to realize that, oh, okay, so this signal means that when I ask for it, I'm going to probably get what I want. It means it's available. Now, if you had another signal up, an opposite colored signal or a different type of signal that was different from, again, something distinct, that would be kind of like the light on the Coke machine being out. And even though they could, quote unquote, put their quarter back in, or they could make the request, over time they'd realize that they're not going to get a Coke. They're not going to, the request that they make for whatever they want is also just not going to happen. Okay. So, it's very important that these signals are consistent and distinct. And so you'll hear me reiterate that throughout the rest of this presentation. Now, some other things to think about here too is that this is also how things kind of get messed up sometimes for kids, isn't it? I mean, it's really kind of like if you had, what if you stepped up to a Coke machine, the light was on, you put in your quarter, and you pressed the button and nothing came out. What would you do? Well, I know what I would do. I think I'd hit that button a little bit harder. I think I might start punching it. I might try tipping over just a little bit to see if my Coke drops out, or my quarter comes back at least. I would start to be kind of mad. I mean, every time that I've pushed this button in the past and the light's been on and I put in my quarter, it works. Why isn't it working now? And so you can see how, like, sometimes if the signals aren't clear and they're not accurate, that could be really confusing to a kid, and it could also create some problem behaviors or some challenging behavior. And of course, the opposite is the other end of the spectrum, right? So what if you had a weird situation where the Coke machine looked like it was off, but you kind of decided to put in like your quarter anyway just to see. You just want to test it out, right? And what if you actually got the Coke, that you wanted? Or what if you put in your quarter and you hit the button 3 times and then a Coke came out? Now, imagine that was like a kid, right? So imagine that a kid, came up to you and you weren't really careful with like the signal that you trained up, and it was like a false signal, but they wanted to just test it anyways. And maybe they did something weird, or maybe they just punched it 3 times and, and all of a sudden they still got what they wanted, even though the signal wasn't saying, hey, this is available. So, you could see how like there's opportunities here for them to maybe not, eventually not desire to communicate anymore because they're not getting what they wanted, or they might learn to respond inconsistently for what they want, and maybe engage in some other kinds of odd behaviors or challenging behavior because the signals aren't clear. And so I like this analogy because there's lots of different things that can happen, but the signals that we use are very important. Ultimately, some things that you would probably need, our general strategies here are that this is something that takes repeated practice. Sometimes I spend whole sessions on this with kids and their families over multiple weeks, and giving lots of homework to try to practice this repeatedly. Sometimes it's right here in my the office here, or maybe sometimes it's in the community, but it does take lots of practice. We also say that we tend to usually practice gradually. One of the things that we have found is that when we use signals, most of the time, if you train it like really well and carefully, a lot of times you maybe don't have to, you don't have to take as long to create periods of time where a kid will tolerate waiting sometimes. But in general, the rule here is that you're going to increase the amount of time that they have to wait. And then, of course, increase maybe what they have to wait for. You might move from easy to hard. You also might move from doing that in situations, different situations, different contexts with different people, right? So if you've heard that term generalization, across people, places, and things, activities, that's kind of like where, the next step. So you're going to practice repeatedly for what's a start, because you want to teach the signal explicitly, but then we want to maybe have that signal really kind of hopefully gain some control. And we can help it gain more and more control by using it more, gradually increasing maybe the amount of time and what they have to wait for and where and who and what. And of course, ultimately, we have to be very careful about praising and reinforcing the success. We want those signals to mean something. So again, this is kind of where I had like a bunch of situations here. I actually had a bunch of visuals. So again, I didn't have time to put some of these things back in, but I have a feeling I'm going to have to re-record this for folks if they'd like it, and certainly provide the slides if I can. So a lot of times things that we use for training up these situations are maybe the presence or the absence of something. So sometimes we'll use things like bracelets, but one of the things that we'll also use sometimes is things like floral lace. It's because you can wear it around your neck, or you could wear any sort of necklace. You could use a hat. You could use really just about anything. What really counts here is that when we use these different kinds of signals, they have to be, again, they need to be distinct. They have to be kind of portable. And they have to be something that you're okay with, even as a parent or an educator or a professional. So we know that there's always a risk or a challenge that we're drawing attention to a kid or to ourselves in the situation by using these things, because we're using these in a very specific way. But you can sometimes use materials that maybe look a little bit less intrusive, but can also be very distinct. So a lot of times the bracelet we would use is like an Autism Speaks kind of bracelet, the blue ones, or ones with different kind of colored puzzles on it. And so sometimes we might use a bracelet on. We might have a bracelet that we put on to signal when a kid is going to wait versus taking the bracelet off. Actually, I take that back. We probably switch it around. Bracelet on, we might it means that if they see the bracelet on your wrist, they might be able to ask for an iPad. They might be able to ask for, different kinds of things, especially like attention or certain kinds of activities. Again, sometimes we might use certain kinds of visuals to signal when screen time is available versus no screen time. I'm gonna stay here for very long because I think we do have some visuals later on here. So, but let's kind of start off to maybe some prior considerations here. So, again, you need to think of initially about what are those problem areas. We talked about that already, but you also need to think about the kid's ability and method for communication. So, what's in their repertoire? Like, what do you have to teach? So, if you don't have a communication response that the kid can do pretty independently, you might have to teach that first. So if you're kind of in confusion about how to teach that communication, reaching out to your teacher, a behavior analyst, or a behavioral psychologist is usually the direction I would go. There are certainly some speech pathologists that also have some skills in training functional communication as well. So if they don't have a way to, if they don't have a communication response, you're going to have to teach that first. And that could be, again, through an AAC device, card touch, card exchange, any sort of vocal response or approximation, sign language using sign. But you need to think about that because they need to be able to communicate for it when it needs to be clear to you and probably to most people what it is that they're asking for. You also need to think about the severity of the problem behavior because these methods could be used for very minimal types of problem behaviors. They don't have to be things that would necessarily, they're not your worst case scenario, but certainly these are also kinds of situations where for kids that might have even less skills than some others on the spectrum, you might need to think about engaging a professional because they're severe. Again, some of these methods are for kids that I've dealt with for severe self-injury, certainly severe aggression, severe property destruction, and some other kinds of things. So these are methods that certainly can be adapted, but training up waiting can really evoke a lot of frustration and problem and challenging behavior. So you need to think about the severity before going too far. And if it's going to be something where you're worried about the safety of the kid or someone else, I'm going to strongly encourage you and that you would need to want to talk to a professional. Certainly welcome to consults or discuss things with us here at Developmental Behavior Pediatrics if you have any concerns or thoughts and you want to check that out. Now, so step one is, again, you need to anticipate what things are kind of difficult for the child to wait for and when they often might need to wait. So this could, again, be for attention, playing a game with parents, getting help from a teacher, preferred toys, preferred snacks, activities, outings, whatever the case may be. Anticipation is always where we start because if you can nip it in the bud by just being prepared, that's well over half the battle. Next, you need to kind of select a type of visual to use because there are different kinds of visuals that are matched probably to better scenarios. And so I'm going to share with you some different visuals that we use and try to describe how we teach those or use those in training and moving forward. So selecting a visual is kind of based on the situation. So one of the things that we do use a lot here is visual timers. Now, again, this may not be new to any of you, so I'm not going to pretend like it is, but I do want to explain it for those that it might be new to because I do explain and show these things to families sometimes, and it seems like they had not been exposed to it yet. So there's lots of different kinds of visual timers, right? So you could use things like kitchen timers, sand timers, some of the things that we dig a little bit more lately are things like the Children's Countdown Timer, which is an app that's available about, both across like different kinds of mobile platforms. And then there's also a Time Timer. Now, Time Timer also has an app, but they also have a number of other devices like different kinds of watches. They also have more mechanical types of operations. So what you see on the screen here with the that's on the iPhone, the mechanical or battery operated kinds of devices, they have like big and small representations of this. The big one is like maybe 6 inches in circumference. The smaller one's probably more like 3 inches in circumference. Both the Children's Countdown and the Time Timer really do about the same thing. They're most useful when someone needs to wait for probably just a few minutes, maybe longer. I certainly have had kids wait up to, using this particular type of visual, 25, 30 minutes. And I've also had some families use things like the Time Timer, maybe not something on their iPhone, but I've had them use like the larger 6-inch kind of battery operated one in their kitchen to help, a kid who was on some medication for that made him very hungry, but at the same time needed to actually kind of wait. So they would set it for the full hour. They're okay giving him like a healthy snack and having him choose from a menu of healthy snacks every hour. They were trying to watch his weight, even though he was also consistently hungry from his medication. So it could be used for a few minutes, maybe perhaps longer. Waiting for dinner to be set, waiting between bites of food, waiting for a sibling to be done on the iPad, waiting for the other iPad to be charged or their particular iPad to be charged, waiting before you go outside, waiting, anything that kind of fits that context. So why do we like this? So I like this because it combines a couple different things. There's one, it's always consistent. Once when you use it, it's pretty much the same every time, except for on the Children's Countdown Timer, you can change the sound and the visual picture that it reveals. With the Children's Countdown Timer, what it does is it starts off green as a whole pie, and then as time goes down, it continues to turn and change colors. And by the time it gets over here to about 3/4 of the way, it's usually turning brown and dark red. And usually this last part is turning red. And then, of course, as it reveals the whole picture, it goes off and it does like a little glitter splash kind of thing. It makes the sound that you program it for. And you can pause it. You can fast forward the clock. You can rewind the clock a little bit. There's different options that you can use on it. And so what it does is it's a consistent signal. It's clear. Sometimes kids like to choose the background. And I certainly have had patients that like that part of it too. In addition to that, when it's used in such short amounts of time, usually a parent can be or a teacher or whoever can be very careful about once that alarm goes off, it's a clear signal that you then are now ready to deliver exactly what you need to deliver. So a couple of things that unfortunately am not highlighting on these slides of things that you need to make sure that would make training effective is that going back to this other slide here, that you're going to practice this pretty repeatedly, and you're going to start off small, and then you're going to slowly increase the amount of time that they have to wait over time, and maybe in different situations, et cetera, et cetera. So one of the things that you have to kind of make sure that you're using here is some judgment. Whatever it is that they're waiting for, you have to make sure that they don't have access to it. You have to control for it. When they are waiting, it could be very hard in the beginning. So you need to be ready to ignore a lot of that problem behavior or any sort of challenging behavior that might come up. And since you have control over what it is that they're waiting for, you need to make sure that whenever the waiting time is done and the timer does go off, you need to be ready to actually deliver it, okay? So we do this very discreetly, not discreetly, but very tightly here in clinic, and we practice this multiple times with kids. And we've done it for a number of a variety of things. For most kids, they seem to really like this as a method when you're just waiting for a few minutes or perhaps longer. I tend to prefer it. There are some other methods that I've used in the past, but I like this now. And so myself and a number of our clinicians here use this. So we kind of have like the weight cards, but I sometimes like to think of the weight cards also in the context of this other kind of thing I'm going to talk about here in a little bit, which is teaching to weight with specific colored cards, objects, and choice boards. But I'm going to break it down for the weight cards. So in general, people like this because it's very obvious and, you know, it's just very explicit about saying like, we want you to wait. And this is a signal that we want to train up. So again, this is something that you would probably use when you don't know exactly how long a child needs to wait. Again, usually something better for brief amounts of time. But again, it matters how you train this. So we're starting off small. We're gonna use a pretty regular script. And when you're running out, and that's one of the things I had written out prior to this, I had kind of like protocols written out for how you would actually train up, an example of like how you would actually go through step by step and what you would do. But for example, step by step and what you would do here is that you might sit down with a kid at the table or somewhere and imagine that they're waiting for their iPad or they're waiting for something, and you wanted to go ahead and actually have them just wait, but we're not sure how long you want them to wait. You might have in your head like an amount of time that you want when you're training, but you know, ultimately you're going to use it for situations where like, it's a brief amount of time, but I'm just not sure. And, and maybe I like that better than using the timer for my particular kid in this particular situation. Because you can teach up multiple signals. It doesn't matter how many you train up, as long as they're consistent in terms of the consequences. So you might sit down with the kid at the table or somewhere with a weight card. You might have them play their iPad for a minute or two. You would then remove the iPad and say like, my turn. And then you'd hand them the weight card. And then maybe after like initially you might just do that for like 10 seconds. And then you would take their weight card and then hand them the iPad. Let them play the iPad for another minute or two. Take the iPad back, hand them the weight card. This time maybe you're doing 30 seconds or maybe a minute, depending on what you think is, you know, where you want to, kind of test things out and figure out like how long could they wait with this weight card. And you're going to do this back and forth. But what needs to happen here is that when they have the weight card, no matter what else that they do, whether they try to put it back in your hand, in your pocket, or whether they start to engage in some challenging behavior, the weight card is still there. So even if they crumple and crinkle it and throw it, chew it, spit it in the trash can, and I've seen it happen, you might want to have a couple extra on hand, right? So with all visuals, you always want to keep doubles because inevitably they're going to get lost, dropped, ruined, and break or something. So have another one on hand. And maybe this time you don't hand it to them, but you show it to them because they can't seem to, holding it is something not okay because they're going to try to ruin it. And if they're trying to attack you because like now you have the weight card and they think that weight card has the control, maybe you need to put some Velcro on it or tape and stick it to the wall where they can't reach it, right? So, but you're starting off really small so that you hopefully don't get that really increase in problem behavior and then moving on. And then, of course, from there, it's about a matter of kind of extending further and further. Again, first then is something that most people are familiar with. So usually something used for completing, again, something before the activity that they want to do, kind of like grandma's law. So eat your dinner, then dessert, do homework, then computer. But again, for kids that maybe are repeatedly asking for things with a visual, now you don't have to kind of repeat yourself every time that they ask for it. You might say at the beginning, first eat lunch, then playground, but after that, you might just tap to it. And stop answering the repetitive questioning that seems to happen at times. There's lots of resources out there through Autism Treatment Network, which is part of Autism Speaks, and other sites about teaching using visual schedules. But teaching to weight with visual schedules is also really a lot about just you knowing when a kid is going to asks for something or has difficulty waiting for something, and it's going to be longer than just a few minutes, but not more than a day. And they can only have something a certain number of times a day. So all those examples I gave you of the favorite snack or special play times, again, now doing it in such a way that you program out so that you can direct them back to the schedule when they might repeatedly ask when they're going to be able to have a snack. And of course, with this schedule, you might remove the things that they have completed as they go through their schedule. You might cross it off so that they know which activity that they've progressed through, depending on the level of the kid. Of course, we also do this with visual counters. We have a number of patients in our clinic where they have their favorite toy store, their favorite place to go to, like Seabreeze. They want to go to Target. They want to go to their favorite places to dine out because they're very picky and selective with their food. So we use visual counters just like this, very common. They need to wait longer than a day usually, of course, if we're using something like this, and you can only go somewhere a certain number of times a week. So different kinds of preferred outings, favorite food restaurant are good examples here. And so this is just you taking control as a parent, as an educator, as a clinician, and helping explain when something's going to happen. Days that have gone that we're done with, the days that are coming, and how long they have until something is coming up. And the last one that I'm going to talk about here is teaching to wait with specific colored cards, objects, and choice boards. We use these probably the most, but we do obviously we use all these methods to adapt to our children. Usually it's when a child asks for or has to wait for maybe like some multiple things, like the choice board. And, you know, or there might be some things that, again, these different colored cards, like the red and green card or the bracelet, where you have a bracelet on to signal when something's available, or bracelet off when something's not available. You know, the color cards and the bracelet are for like when maybe we're not sure what the kid might ask for, or we just don't like the choice board, or there's too many things that they might ask for. We might use those kinds of signals, but a lot of times we end up reverting to some kind of a choice board in some manner or form. And simply, it's exactly what it looks like. It's simply on one side it's green, and one side it's red. And whatever's on the green side they can have access to. Whatever's on the red side they can't have access to. And so when it comes to this, though, you know, it's really a matter, again, it really comes down to the specific teaching. It's about systematically starting off with having them wait longer and longer periods for those things that are on red. And sometimes rotating those things off of red onto green and green onto red, so that they get practice tolerating, you know, the denial or delay or the waiting. So they tolerate waiting longer and longer with all these different items, because and so long as, again, those core elements of whatever is on red, they don't get unless it's, again, put onto green. So if it's on green, they always can have access to it. That's an important part of this, because that means they learn the meaning of what green means. And then, of course, if it's on red and they ask for it, or they take it off and hand it to you because this is on Velcro, or they point to it, or they vocally ask for it, you would probably need to respond like, it's on red, we have to wait. And again, no matter what the challenging behavior is, so long as it's safe, you know, in other words, not doing injury to themselves or to someone else, in that case, you might want to, again, work with a professional. You need to make sure that no matter what they do, if that picture is on red, they don't get access to it. So that's, and again, going through this repeated practice over and over again is what makes those things work. And this is all built off of, you know, these rather fancy kinds of research things that we've done around stimulus control, how to communicate, and how to teach when things are available or not available. And what we found is that actually these things really do help. They keep up a kid's willingness and desire to communicate if they don't have good communication skills. And it also really prevents some of that repetitive question asking that can be really kind of troublesome. It also tends to prevent some of the challenging behavior that arises. So that challenging behavior might be a little bit worse in the beginning because everything's a little bit rough in the beginning, but reduces that problem behavior, but usually much more quickly and to much more lower rates. So again, once you select the type of visual you're going to use, you're going to want to help your child become familiar with it before its use. If you have a kid that responds to social stories, which I like to think of as just a way to explain the rules, we would do that. We do sometimes modeling and demonstrations with kids where sometimes, I have them be the teacher. I have them be the clinician if they're that savvy, or I have them watch mom have to wait and practice with it. So you can model it on someone else or yourself. And of course, we also sometimes provide verbal instructions like, when the bracelet's on, you can ask for the iPad and you can have it. But if you don't see the bracelet, it means you can't have it. Or if it's on green, you can have your iPad. But if it's on the red side, you can't have the iPad. You'll have to wait. So once you kind of decide how to kind of explain this to them and maybe model this, we usually like to kind of just do some, again, really quick practice here, short periods of time. Sometimes we actually combine all these things together. Sometimes when we're introducing a choice board with things being on the red side and green side, we'll also set a visual timer to help them kind of learn to understand the passage of time, how much time is going to have to pass, and to make the connection that, once the timer goes off and this gets moved over to green, maybe I'll get an opportunity to ask for what I want. So start low and go slow. Again, waiting for brief amounts of time is always easier. Again, waiting for things that are, moderately preferred things is easier than waiting for the most preferred thing. Also, what we like to kind of mention is that at any time when a kid is waiting, some of the things that you should be thinking about is, what else could they be doing? Is there anything else that would keep them entertained? Even when you're training this, is there something else that would keep them a little bit entertained? Maybe it's not the favorite thing and the thing that they want the most, because that's what you're training with as like the thing that they have to wait for. But you're actually also using maybe some other lower preferred kinds of things that would at least kind of keep them busy and something to do. So that way they're just like not able to do anything, and they don't have anything to do, because that'd be kind of weird. So the research also suggests that in addition to doing this kind of training, sometimes when a kid has to wait or things are on red and all that maybe provide something else that's a little bit less preferred. And ultimately, as you slowly increase the time and what it is that they need to wait for, then you'll see that these skills kind of usually grow to be stronger and stronger. And we also see, again, usually less and less kind of troublesome behavior in whatever form it is, like repetitive question asking or some of those other things. And of course, what counts here is really that accurate delivery and the accurate presentation of the signals. So make sure red means red. Make sure green means green and it's available. Make sure that when things go onto green or the timer goes off or you take the wait card or the wait card goes away, that you deliver what it is that you've trained it to signal that it's available when they ask for it. So you need to be accurate with those kinds of things to really make these things work. So in summary, waiting is hard for all kids, particularly difficult for kids with autism for a variety of reasons. And, they're really significant reasons. But what we find is that visuals are a way to overcome a lot of these challenges and to develop some of these skills that they just don't naturally pick up like we see other kids tend to pick up. They're proactive. They help you prepare for, the trouble spots for your kid. You're going to have to practice and teach waiting outside of times when your child actually has to wait. So it's what we do in our clinic. I set up artificial reasons for a kid to wait, and we do it. And then that's kind of what we have them practice at home. And once we kind of get some success going. So, in general, you need to kind of think about, like, again, as what it is that they're waiting for is kind of like a reinforcer, a reward. And you have to think about, again, red needs to be red. That means if it's not available, you have to have control over it. And there's no way for that kid to actually have access to it unless it's on the green, or the timer goes off, or you take the weight card away, et cetera, et cetera. Always praise your, oh, I got some misspelling there. Always praise your successes. Be patient. We are asking these kids to do a lot and to change. It means that we also probably, they deserve some respect, and we also need to change. And so we deserve some patience. We're asking them to do some really hard things, even though we think it at times should come a lot more easily. Okay, that's a rather quick version. I realize that we're really kind of short on time, but I certainly wanted to open this up for any sort of questions that you might have. And if you don't have questions, that's also okay. We can certainly, you're more than welcome to leave, but I certainly want to just give a little opportunity for anybody that does. Yeah, so there will be slides available soon. I don't know exactly what the time frame is, but my understanding is that once this is kind of once this is done, you should get a link that'll provide you access to the recording. It'll also provide access to the your CEU attendance certificate and all that kind of whatever. But what I need to do actually is I'm going to work on these slides, and I'm going to see if I can give you a much more updated and thorough kind of set of examples and protocol details about how we might do this. I mean, all I can say is that when we do it, it generally works. So I do find that these things are helpful and a really important part of a lot of what we do in many situations. Good deal. But thank you, Jen. So we have a question here. Sometimes a kid knows he needs to wait, but he's eager to do something or feeling boring and waiting. He doesn't know what to do to deal with the boring time. Yeah, so in many ways, Emily, so I think what you're describing is some of what I was trying to refer to. Some kids actually just don't have good leisure skills, right? Like they don't know a way to kind of really keep themselves entertained. And that kind of turns into a whole nother question. I certainly have, I have a kiddo right now where he always likes to go for walks and whatever. And so it's hard for him to wait for those kinds of things, but also doesn't seem to really kind of know what to do with himself in the meantime. And we're actually at a stage right now where we're actually having to introduce lots of things that maybe he's never seen before, just to kind of get an idea of, is there anything that we could get him to, interact with and do for, some of those wait times. It's harder when it gets to really long wait times though, isn't it? So what we find is that sometimes during waiting, we might end up deciding that what might be kind of sabotaging or kind of not really giving the particular intervention that we're doing a lot of effect is because we actually have to stop and maybe think about teaching some kind of a skill. There are some kids where we've had to do wait protocols for them, but they might be able to wait 10 minutes, which is actually not bad for some of the cases I've seen. And ultimately what we had to do is we had to kind of create opportunities for them to do other things while they were waiting. Sometimes it was going for a walk, but sometimes it was actually creating I'm forgetting the name. But basically what I call it is almost like a visual task baskets where we had to teach them how to create we had to teach them how to complete a certain number of closed-ended tasks that were in kind of assigned task baskets. And once, just to kind of get him to do certain activities while he's waiting to make it kind of go better. But yeah, it's hard. Okay, a question here. When working on specific lessons, a kid completely shuts down and seems to protest by acting bored. During this time, it's best to implement a wait time to see if this will help break up or distract him the amount of work he needs to get done. So I'm really glad that you brought this up, Mallory, because actually this is a little bit of a different situation. So what I really probably presented here today is the best case scenarios to use some of these are probably when a kid is asking for or seems to be wanting some kind of adult attention or needs an adult to get them something, like an iPad or a walk or going to the playground or a snack or something like that. So those are things that that kids are doing for attention or a tangible activity. What you're describing is certainly something that would be more along the lines of he's asked to do some work and he he doesn't want to do it, right? And he might act bored, but the truth is, and he could be bored, I don't know, but he also really just doesn't want to do it. So in that case, it's not that he's doing it to get access to attention necessarily. It could be part of it. And he's not necessarily doing it to get access to maybe a tangible or some sort of activity, but he certainly is doing it to escape what you're asking him to do, right? So that's one of the things I did not address here today with visuals here is what to do for using visuals to communicate when work is going to be done and getting access to maybe something else that they want. That also is a form of waiting, but it would have opened up another can of worms that I probably wouldn't have had time to get to given the other topics that I was wanting to talk about. So if you have a kid that's actually engaging in, if you're giving them work to do and they're doing other kinds of behaviors whenever you present them work, they're probably trying to get out of the work or just delay having to do it altogether. And in that case, we don't use wait cards usually. What we usually would do at that point is take a step back. Evaluate if there's anything that we could do to change the activity to possibly increase a kid's willingness to get it done. But if we can't really seem to do too much modification, sometimes we do something very similar, but really quite different where, again, if this is a kid that maybe has verbal kinds of skills, so he can ask for a break vocally, we might give him like a card or something in addition to the fact that he can ask for a break. And we do a particular kind of intervention called demand fading. It's not always the easiest or the best, but and I say that because it takes sometimes a long time, but we have a number of children that we've seen over the years where we give them certain kinds of work or any kind of task, and they'll engage in, again, self-injury, aggression, or other kinds of severe behavior to kind of get out of doing the work. Because if they do something severe enough, people back off. And so what we usually do is we figure out the kinds of things that we need them to do or want them to do, like daily living skills or just even obviously there's certain kinds of academic work that they could do or different kinds of functional tasks that would be meaningful for any sort of employment that they would do later in life. We try to figure out what those are, and then we figure out a way to break it down. And we'll use visuals for this. In other words, a common scenario that we've done before for teaching kids to do more and more work, especially if it's not preferred, is we might bring a kid to the table. We will take maybe a worksheet or the particular basket full of certain things that they need to do. Usually it's one task at a time or something like that. And what we'll do is we'll put it down on the table, but we'll also, and again, I'm taking the example of maybe a nonverbal child here, but you might put the task down on the table and at the same time put down a card that they could, touch or hand you so that they could take a break. And we might pair that with like, again, a green signal or like a green card that's present. And so we might do that a number of times to make sure that they know how to request for a break. But then also what's part of that though is if after we know that the kid knows how to kind of request for the break and all that kind of stuff, and they have an idea of what the initial green signal might mean, we might have them do one problem, one part of the task, just in isolation. And when we present the thing that we want them to do, we turn the card over on red. We use least to most prompting so that we kind of give them a verbal instruction, gesture, and then kind of physically help them complete what it is that we want them to complete. And then we flip the green card over, and then they can request for a break at that point. So we start off, again, very small, and then we work up very big, and we keep on trying to increase the number of problems that they have to complete or the number of tasks that they have to complete over time. And while work is being done, the red card is out. But as soon as break is available, and we would know the criteria, right? We flip it over to green, and then they can exchange the card or they can ask for a break. So it's a whole other different part of functional communication training and, again, tolerating delay denial. But again, what makes that particular intervention work is that work doesn't go away, so long as there's work to do. And also, whenever the red card is out, it means that, whatever it is that you did want to do that was fun, you're not going to be able to do it because you have to do the work first. So it's a little bit more complicated. I would say, like, if this was something going on in a school or somewhere else at home or whatever, again, my experience is that you'd want consultation with somebody that knows something about demand fading and how to treat escape maintain behaviors to kind of really take a look at the situation and tweak it. I'm not saying that you couldn't do it. I'm just saying, if you're not familiar with it, there are some things that you could do. Okay. Not seeing a whole lot of other questions here, but I'm always happy to help in any way that I can. I will try to upload a much more useful set of slides, and I thank you for all your questions and your attention. And I apologize again for all the technical difficulties, but anyway, this has been great. And look forward to the email with the links to the recording and slides for anyone that registered. Okay. All right. In that case, I think we're going to go ahead and dismiss this, and we'll call it a day.